Welcome. My name is Jason Helgerson. I'm the New York State Medicaid Director, and this is the latest in our New York State DSRIP Whiteboard series. Today's topic, DSRIP Year 2, and the theme for this new year of DSRIP, which just began April 1st, proceed with fact-based optimism. This is the theme that we rolled out at an all-PPS meeting very recently, and the goal of this presentation is to talk about what it means to be fact-based optimists and why that is important in our efforts here to really improve the health outcomes of millions of New Yorkers who are benefiting from the Medicaid program and really transform how care is delivered in ways that are very important and very structural as we move forward in DSRIP. So what is fact-based optimism? Well, first and foremost, we have to acknowledge that DSRIP is a very challenging but also very exciting opportunity for New York State. Tremendous level of investment going into really improving the health outcomes. We are very fortunate here in our state to have this opportunity. Many states across the country would love to have this level of investment going into its delivery system. But that said, we have to also understand that each of the 25 PPSs and their network partners face significant challenges in implementing the plans that they signed up for at the end of year 0. And as we begin year 2, we hope that folks will go in understanding what those challenges are, but also embracing the exciting opportunity that is DSRIP. So as we embrace that opportunity, we need to proceed forward with optimism. Why is optimism important? Because our belief is that providers, organizations, individuals, when they believe that what they're trying to do is possible, they will be more effective in the end, that they'll be more likely to achieve their outcomes. And really what we're hoping for in all of this is that each and every one of the PPSs will create a culture, a possibility within their PPS, and that it becomes basically a cycle, a positive cycle where organizations feed off each other and really work towards these goals in common cause and help each other along the way and believe that what at the core we're trying to do in DSRIP, which is improving outcomes in healthcare for those who are vulnerable in our society, is in fact possible. And as a result of that commitment, we'll stay engaged in the initiative. That said, we have no time for Pollyanna. This is a very challenging initiative, and each of the PPSs and their network partners have to go into this with their eyes wide open. We don't have an opportunity, or we're in a situation with the stakes as high as they are, to go in with blinkers on and think that all will be right in the world, and then we really don't have to fear some of the challenges that are going to come and face each of the 25 PPSs along the way. So at the end of the day, we must avoid Pollyanna and really be focused on what we can do within our resources to achieve the goals of DSRIP and be very practical about our approaches. But lastly, the flip side is also the case. What we can't do is allow pessimism to dominate our discussion. Pessimism can become a self-fulfilling prophecy. If providers within an organization, within a PPS, begin to believe that what they're trying to do is not possible, and that becomes the systematic belief of within the PPS, no one should be surprised if that PPS begins to fail. At the end of the day, we must have optimism. We must believe that what we are trying to achieve, both within individual organizations and across the PPS wide, is in fact possible. And it's going to be really important for the PPSs to build that feeling across these diverse organizations. There are lots of ways to do that. We'll talk more about that in the future, but I would encourage the PPSs to really engage in communication across the PPS, to encourage and include providers in the decision-making process, make sure they know their role, and feel supported in those roles as they confront the challenges of DSRIP. So that's it. Hope you found this useful. Just so you know, this wasn't our idea. Fact-based optimism comes from this gentleman, Bruce Mau. And here's his website if you want any more information. A lot of interesting ideas relative to system change and how some of those things might apply to DSRIP. So thank you very much and look forward to seeing you at our next whiteboard video.